Dr. Kennedy, can you tell us what is the current landscape of COVID-19 at the Thunder Bay Regional Health Sciences Centre today?
Certainly, Janice. Today we have one patient, COVID-19 positive, in our ICU, but in very stable condition. We have 6 patients on our COVID-19 unit. They're what we call presumptive, and they have not been confirmed to have COVID-19. We have a total of 24 presumptive cases in our hospital, but the vast majority of these always turn to be negative, but we just take special precautions so we don't endanger our healthcare staff to any unnecessary exposure. And our current capacity at the hospital is about 72%. So we have sufficient capacity to take on any influx of any type of medical or surgical needs.
So is it safe to say that we have flattened the curve when it comes to COVID-19?
Absolutely. Looking at the provincial data, the north is in much better sort of shape than the rest of Ontario. The rest of Ontario is not doing too bad either, but we have definitely flattened the curve here in northwestern Ontario and northern Ontario. We had just one positive case yesterday, and patients in the community and self-isolating at home. So looking at the numbers, and our growth rate is very little. The rest of Ontario, all Ontario now, the growth rate of new cases is decreasing, which is good. The numbers, you'll see numbers have been increasing a little bit, but the percent of growth rate since this first started is decreasing throughout Ontario, but the north is much better shape than the rest of Ontario.
Well, that's great news.
It is.
Can you explain the difference between close contact and community spread when it comes to COVID-19?
Yeah, so close contact really means anywhere within 2 meters of another person. So you want to avoid that close contact. But community spread is totally different. Community spread is where there's a case who's tested positive for COVID-19, and then the public health does a sort of a contact list, and they're really unable to find any potential contact of that case that was related to an index case. So we don't know. They don't know exactly where that individual contacted the COVID-19, but we have very few of those cases in Thunder Bay. The last I talked to Dr. Mill, I mean, the number is definitely under 10.
There's a lot of rules when it comes to self-isolation, not even self-isolations, but social distancing, physical distancing. Is it safe to travel to another household that you know is safe if you keep under the 5 people?
You know, the purity of the answer is no. In the sense, you really need to continue to stay at home, Janice, and that's what you really want to encourage all members to do until we really get a better handle on disease progression. I know we're flattening the curve, but we're only flattening the curve because of the good sort of behavior of our residents of Thunder Bay. And once you start sort of, you say you're going to visit other family members, that usually doesn't happen, actually. Now, I mean, that's our recommendations. I know individuals from time to time have unique circumstances, and they're going to want to see their loved ones at some point in time. If that happens, we still don't encourage that, but certainly we know it's going to happen. So make sure you practice your physical distancing. Have a barrier sometimes in between you and the person you want to go sort of visit, but you still must keep it 5 or under. The people who are the ones living in the household can be with family, but we're still not encouraging family to go visit other family members at this point in time. But I think we need to look at easing those soon in the future.
Yes, hopefully soon.
Yes.
Are you able to share with us how many people have been tested for COVID-19 and what the results have been?
So here at the Thunder Bay Regional Hospital, we've actually total have done about almost 2,300 tests at the regional hospital. That doesn't take in consideration how many tests that the community paramedics and the Thunder Bay Health Unit has done. So we've done about 2,300 tests here. We have, as far as we've got still a number of tests pending, actually, and the amount of positive tests throughout the community in the region of Thunder Bay is 75. But I think the total number of tests that we've done throughout the Thunder Bay is well over 3,000, probably 3,500, with only 75 positive. So again, you're doing excellent work there.
And a lot of those cases have been resolved?
Oh, yes. I think at this point in time, talking to the District Health Council, Columbia Health Council, 49 of the 76 have been resolved.
That's great.
That is good news, yes.
Are there any new symptoms for COVID-19 that have come up, and do you have to have more than one symptom to get tested?
No, now it's still just the one symptom, and that still includes a fever, new or worsening cough, and shortness of breath, and those are the real major ones. But some of the other ones, and you just need one of these symptoms: sore throat, hoarse voice, difficulty swallowing, a decrease in your sense of smell has just come out, and taste has just come out. GI symptoms like nausea and vomiting, runny nose, sneezing, nasal congestion, as long as it's not related to allergies. Also conjunctivitis, which is inflammation, red eye, has just come out as a new symptom. So these are really, really changing all the time. I mean, the list goes on between unexplained fatigue or malaise in the elderly, acute delirium, confusion, unexplained falls, chills, headaches, croup. So as you can see, I mean, it's almost anything, and you just need one symptom or less, or one symptom to actually request phone the health unit, and they can send you to the assessment center.
If you are diagnosed with COVID-19, are there any over-the-counter medications that will help with the symptoms?
None whatsoever. I mean, if you have a high fever, taking Tylenol is still, or acetaminophen is still recommended. Lots of fluids, and really just stay at home.
What about prescribed medications? Have they found anything that helps that you can get prescribed?
There's no prescription medications for people to take as an outpatient. There is some early evidence that an antiviral drug that we use for Ebola can decrease your length of stay in the hospital from 14 days to 11 days. But that's still really being researched on, and I know in the United States that they're recommending it. But again, that's just for usually the ICU cases. Doesn't help to take anything when you're at home, except the acetaminophen. So it's more just a hospital-based medication that our ICU doctors and our internal medicine doctors are using. But the advantages are not that great at this point in time.
Okay, now the Ontario government is starting stage 1 of opening businesses in Ontario. Do you have any advice for people going back to work, or what does the community need to know?
I still feel, we still need to be safe. Here in Northern Ontario, we're we're in a better situation than down in Toronto because our rate of growth has really declined. We've really flattened the curve, but you still have to use common sense. So you still have to maintain your physical distancing when you can. But when you start getting into the beauty salons and the barbershops, I mean, that's going to be difficult to maintain. Dental's office is going to be difficult to maintain. So in the areas where you cannot maintain it, certainly I would recommend having a mask both for the client as well as the practitioner who's doing the investigations. Wash your hands, wash your hands, wash your hands is the biggest advice. Don't have a full waiting room. Have one person at a time come in. I mean, we're not there yet with with those recommendations, but I'm assuming they're going to be coming in the very near future. And it's safety, 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 because I mean, you want to protect yourself, you want to protect your client, and you don't want to have a second wave of this COVID-19 influxing into the hospital where we have very critical PPE supply, and we want to protect our healthcare workers.
Will anything at the hospital be opening up with stage 1?
Yes, we started opening up this week. We started opening up priority surgeries for many of our neurological procedures, our cancer procedures that individuals have been waiting at home for greater than 6 weeks or so to get these urgent cases done. We're opening up our outpatient for endoscopies, so we are looking for any type of bleeding ulcers or any type of cancers in the stomach or the bowel. We're opening those suites up because we've got to get back to business and take care of the health of the population. And we're going to gradually expand our services to make sure we continue to priority taking care of the individuals who really have really patient staying at home for a period of time. So we're moving ahead with opening up a number of sort of outpatient procedures that we require to take care of the health of the population.
Now, COVID-19, I think, has lasted a little bit longer than people expected. Do you have a positive message for the community just to continue with this?
Oh, absolutely. I mean, we dealt with, we deal with influenza every single day. We deal with infectious disease in our hospital called MRSA, C. difficile. That's part of our community. The positive message is we've learned a lot from the hospital. We've learned a lot from healthcare providers, how to prevent the sort of spread of this virus. It's really up to individuals to take into consideration how they can stop the spread. We're working on a vaccine. I suspect it'll be a year and a half where we have the vaccine, so that will be coming. But in the meantime, you've got to use a lot of your own, because your individuals, the populations, this is the first time that they are really known to actually maintain the health status of the community. So it's their responsibility to make sure they use common sense and don't have big crowds. I mean, don't take it if you're going out when this thing is lifted for a few drinks or having a social gathering. Keep it to under 5. Bring your own types of cups. Really wash your hands all the time, and just use a lot of common sense and consider everybody potentially is a spreader of that virus. But the biggest reason for all the aggressive movements is to make sure we didn't sort of overwhelm the healthcare system. The healthcare system has not been overwhelmed with this phase 1, so we're ready to sort of accept. We know we're going to get more patients in COVID-19 once it opens up more in the community, but just like we get more influenza, just like we get sort of more pneumonias, it's a common part of the practice. So I think we need to be vigilant all the time, but we don't have to be scared all the time.
Great. Dr. Kennedy, thank you so much for talking with us today.
Thank you, Janis. Have a good day.